Okay, succinylcholine. Also known as anectine. I've heard it called both. Most commonly it's called Sux or succinylcholine. This is a depolarizing neuromuscular blocker. Also known as a paralytic. This is what we're going to use to facilitate rapid sequence induction. Okay, so it does this by binding to acetylcholine receptors at the neuromuscular junction, causing depolarization and subsequent paralysis. So we're going to bind to acetylcholine receptors. At the neuromuscular junction, causing them to depolarize. Causing paralysis. Okay. So now this is causing depolarization. What can you expect with depolarization? What does depolarization do? As we remember from the heart, as the heart depolarizes, it's contracting. Correct? It's causing the muscle to work. So a depolarizing neuromuscular blocker is going to cause the neuromuscular junction to fire. Basically, it's going to depolarize and it's going to stay in that state. It's not going to repolarize right away, causing the paralysis. Okay? Now this can cause fasciculations, and what fasciculations is as those neuromuscular junctions are firing and they're depolarizing, you're going to see the body move. It's going to look kind of like the skin's crawling, even for that matter, little tremors throughout the entire body as this goes through. That's the thing to keep in mind if your patient is a trauma patient, you're suspecting possible spinal damage, that kind of thing, spinal cord damage, C-spine damage, that kind of thing. Just something you want to keep in mind when you're doing that, okay? So what is our indication for this? Well, like I said earlier, this is what we use to induce rapid sequence induction. So that's what we're going to use it for. Rapid sequence induction. Or intubation. Either way you want to look at it. RSI. It's the only time we're going to use succinylcholine. Okay? Its dosing is weight-based. It's 1.5 milligrams per kilogram, or 60 to 150 milligrams rapid IV push, and may be repeated at 0.5 milligrams per kilogram or 20 to 50 milligrams rapid IV push. IVP, IV push. Repeat if needed, again, with half a milligram, 0.5 milligram per kilogram, or 25 to 50. IV push. Now, due to the fasciculations, you're going to want to give that time to happen. So make sure that while paralyzing your patient, A, they are adequately sedated. We went over those meds earlier. Make sure that your patient is adequately sedated before inducing paralysis. Make sure you are absolutely ready to take over that patient's airway, because now, once you push this, there's no going back. This paralyzes the diaphragm along with the rest of the body. You want to make absolute sure that you have the capability, the ability, and the need to totally take care of this patient's airway from start to finish, and that you are maintaining your goals with your escalating airway algorithm at this time, that you are able to bag, you are ready to intubate, you have your rescue airway in place, oxygen, suction, everything is in place. You want all monitoring as well. You want end tidal, you want SpO2, you want cardiac monitoring, you want blood pressure, you want it all. You want everything right there. Suction, you want it all. You don't want to be wanting for anything in the middle of this. You have to be prepared. This can be given IV or IO. Now, what adverse effects are we looking at? Or what contraindications are we looking at? Hyperkalemia. High potassium. Neuromuscular disease. Crush injury, that would result in hyperkalemia as well. Burns, again. Increased intracranial pressure, ICP, increased intracranial pressure. Also, severe trauma. Kind of looking at the same things as crush injury, burns, intracranial pressure, severe trauma. All of this kind of ties together. Neuromuscular disease is kind of the outlier here that you want to be cognizant of. These are things that you want to be very well versed in before you attempt. You want somebody there that has done this before you do an RSI. You want to make sure, again, that you are completely 100% ready and sure that you need to do this procedure, that this patient's life depends on you performing an RSI and performing it correctly to achieve your goals. Some of your adverse effects is this is going to cause hyperkalemia. Bradycardia. Prolonged paralysis. Malignant hyperthermia. increased intracranial pressure, fasciculations that we mentioned before, and trismus. Oh, spelled that wrong. That's a U.